The discovery of antipsychotic medication is one of the greatest medical advances of the last 60 years. Until their discovery, many people with schizophrenia had to live in a hospital. But with the help of these medications, many people can now lead independent and fulfilling lives. Today, there are many medications available to treat the positive symptoms of schizophrenia. They may improve or even stop the following symptoms within a few weeks: hallucinations, delusions, having problems sleeping, feeling anxious, feeling agitated. Sometimes medications can cause unwanted side effects, so there are medications that have been developed specifically to treat the side effects of these other medications. We will talk more about side effects later. It is important for you to ask your healthcare professional about your medication. Learn what it is designed to treat. Many people know that some other mental health problems can sometimes be treated successfully with psychosocial or talk therapy, which is also called counseling and psychoanalysis. These may take the form of individual or group sessions. However, as we discussed in Meeting 3, schizophrenia has biological causes, such as a chemical imbalance in the brain. In most cases, antipsychotic medication is needed to treat these biological causes. We also learned that there are external psychosocial triggers of schizophrenia. These triggers are often treated with talk therapy. For example, people can learn how to avoid stress and how to better manage it if it does occur. All of this together means that a combination of medication and talk therapy is a common way to treat schizophrenia. Your health professional will help determine the best treatment for you. Medication is very helpful for treating acute psychotic episodes. For most people, medication reduces symptoms and even helps them disappear completely. However, it's important that you continue to take your medication, even if you have fewer symptoms or if they disappear altogether, because if you stop taking your medication, it is likely that your symptoms may quickly return. We'll talk more about this shortly. Also, the success of talk therapy for people with schizophrenia depends on good medication treatment. This means if symptoms don't improve and you have a relapse, talk therapy may make little or no difference. Treating schizophrenia is a lot like treating other long-term conditions. For instance, people with diabetes need to treat their condition for their entire lives. They need to take their medication. They might also need to change their diet or exercise more often. The good news: by taking your medication as directed and talking to your healthcare professional, you can reduce your risk of a relapse. We don't fully know how the symptoms of schizophrenia develop, but doctors have found that chemical messengers in the brain are involved. Doctors call them neurotransmitters because they transmit neurological or nerve impulses to the brain. Two important chemical messengers for schizophrenia are dopamine and serotonin. In good health, impulse transmission works well. Schizophrenia can interfere with impulse transmission. In people with schizophrenia, parts of their brain may have too much dopamine or serotonin. These increased levels cause the brain to receive too many impulses at once. This is more information than the brain can handle. This confuses the brain. The result can be hallucinations or delusions. Antipsychotic medication works by acting as a protective shield around nerve endings. This allows the right amount of impulses to pass through and blocks the rest. This prevents the brain from getting confused with too many impulses. Some antipsychotic medications help reduce or prevent positive symptoms of schizophrenia, such as hallucinations and delusions.